your wahala, your breakthrough, idea. Welcome to the chat room.
This no be ordinary place. Now a solution they show face. LadyMary they lead the way. With guests we go blow your brain. Talk your matter make we solve them. No judgment, just love and wisdom. We they discuss, we they learn. Every episode you gon' feel the burn. Oh, the chat room. Now here we they find a way. Oh, the chat room.
Oh yes,
We go talk and clear, no delay. Oh, it's interactive, educative, informative, and unapologetic. Oh, the chat room. We unstoppable, no be lie. You, hey, the chat room. Hey, now here we dey find a way. We the chat room. We go talk and clear, no delay. It's interactive, educative, informative, and unapologetic. Oh, the chat room. We unstoppable, no be lie. Oh, the chat room. Yeah. Now here we dey find a way. Oh, the chat room. Oh yes, we go talk and clear, no delay. It's interactive, educative, informative, and unapologetic. Oh, the chat room. We unstoppable, no be lie. You.
Good afternoon, good evening, good morning to you all, depending on what time it may be at your end. My name is LadyMary Boadu, and I am your host for the chat room, a platform dedicated to resolving daily life issue. Over here, it's all about educating, and our hope is to bring transformation to you, yours, and our communities. And so we hope that tonight's session would be a blessing to you and yours as always. I have with us my co-host and our amazing doctor and his wife, the very right people or the very individuals that would do justice to this topic for tonight. And so I'm hoping that you have your pen and your paper and then call a friend to tell a friend to tell a family member to join us tonight. But before we get into it, Doc, can you please introduce yourself? Actually, ladies first. So let your wife introduce herself, then you do yours, and then we come to Nanaya. Please go ahead.
Okay, so hello everybody. My name is Laurencia, and I guess for the purposes of today's event, I am a psych mental health nurse practitioner, and I also am a mom with 2 kids on the spectrum. So, yeah.
All right. Yeah. So, and I'm Dr. Louise Appiah-Kubi. Appiah-Kubi is our last name. My day job, I'm a clinical psychologist, and my day job, I specialize in assessing individuals with autism, ADHD, learning disorders, etc. So that's my jam on my day job. And as a side hobby, I do a lot of social media education, especially on TikTok. So I do a lot of social media education, again, around autism, ADHD, families, and stuff like that. So, yeah, and she may have underestimated her role in it too. So as a psych mental health nurse practitioner, she is also trained to assess, at the very least, screen for autism and treat ADHD and any maybe aspects of autism that maybe medication can help. That's her jam on that side as well. So, yeah.
Nice. Nanaya.
Good evening, everyone. I am Nanaya Sarpong. I'm the co-host of the chat room show, and thank you all for tuning in once again. I am a mother, a wife, and by profession, I am a financial manager. I am also the founder and CEO of Obia Nana clothing brand, which is an African print-inspired fashion line. Um, Follow me on shop.obia Nana on all platforms. Thank you.
Thank you so much. So my question actually just changed because of your introduction, but we can always revisit that. Is there a reason why you decided to, because if I'm not wrong, I would say you guys are both in both type of the same profession, almost. Is there a reason why you decided to go that route? I say this to say that. Maybe let me just give my reason, then maybe that will help. As Africans or as human beings, sometimes our family members have the tendency, especially our parents, right? They would love to hear that, hey, my son is a doctor, my daughter is a lawyer, and blah, blah, blah. So was there a reason why? Was it a choice, or is there a specific reason why you both decided to go that route?
I think so. I, like many smart kids growing up, wanted to be a doctor. So I went to the University of Ghana in the University of Ghana, your first year you do biological sciences, and then based off of grade points and stuff like that, they select a very small number of people to go to medical school. Didn't make it. I didn't cut it by way of grade points to go to medical school. So my second year at the University of Ghana, I had to figure out what I wanted to do. And so I was taking multiple kind of general courses to see if there's anything that, speaks to me. And I took Introduction to Psychology. That one. And then I took another class, the second semester, of Abnormal Psychology. That was the day I decided I wanted to be a clinical psychologist. Between the professor that taught it and then the nature of the course and how it related to me just made sense, right? So that's the day I decided to be a clinical psychologist. It took me a while to actually get into graduate school, but from that day, the course just, the topic area just made sense to me. And that's when I decided to be a clinical psychologist. I'll let her speak to that.
How I got here, I think, is there a feedback? Well, how I got here, I had never, growing up, never ever thought this is what I would do, ever. Except I didn't think I would be a doctor, though. I thought I wanted to be either a lawyer or like a member of the diplomatic corps. I just laughed that that's the diplomatic corps. That's what I wanted to be. But anyway, but when I went to uni, I read French and psychology, and that's how we met at the University of Ghana. I read French and psychology, and after my bachelor's, like in Ghana National Service, I worked at the Anchor for Psychiatric Hospital for my national service. Thought, okay, this is not what I want to do. So then I moved to the US when we got married. I went to nursing school thinking I wanted to be a labor and delivery nurse. That's how I went into nursing school to start with. I wanted to be an L&D nurse, but took my L&D rotation and I was like, okay, no, this is not for me. I did my ICU rotation, loved it. So decided to be an ICU nurse actually, at the time when I decided to become an ICU nurse, I thought I wanted to be a CRNA, right? But then I also started working the ICU and thought, okay, I love to talk, and people say like my patients' families, because usually my patients are asleep half the time, but my patients' families always think I have some kind of, they can't place a hand on it, but whatever it is. It will not serve any purpose if I'm a CRNA, just putting people to sleep and waking them back up. So I moved away from that. And then I don't know if it's fate or whatever would have it. We had 2 kids on the spectrum, going through what seemed to be like something that we were the only ones experiencing, because in our community, we didn't know anybody doing that, only for us to kind of share our stories and find out that, oh, actually, a lot more people are going through this than you think. And so then we kind of jumped around the idea of, what if we actually had a private practice where I can prescribe, he can do the other stuff, and then we do it together for people in our community, because a lot of people want to go to people who can relate to their situation.
Yeah.
So I went back to school and got my Psych NP, and yeah.
So how is that like with finding out people within our community? Now, I don't know if that would mean our own people, like Ghanaians or African or whatnot. Is that what you mean?
Yes.
If that's the case, then how is that like? I say this because sometimes our people frown on, on things like that. Does that make sense? So are people open to coming to you? I say this because I know someone who would literally not go to a Ghanaian doctor because of, this tag. They don't want them to know their business. Do you get it? So I don't know if have you guys ever had any of that challenge, or maybe based on how you guys work,
So the private practice isn't in full swing yet, right? So we're not seeing, patients on that level yet. However, like in my case where I'm even just providing education and stuff like that, there's so many people coming to my DMs asking questions, and most of them are Ghanaians, right? And some of them are local too. Some of them are people that I can probably bump into at a church event, So I think people are getting more and more comfortable with the idea of seeking support, especially from professionals, because the thing is, it's fair for somebody to think, make come as much LadyMary or LadyMary, baby.
Yeah.
So it's fair. If we're in the same community, it's fair for somebody to worry that their issue might end up somewhere, But I think when people realize that you're a professional, in my case, where it's my job and I could literally lose my license if I'm as a psychologist, you come to me for therapy or for services on that level, and I share your stuff in other places where I shouldn't be sharing it, I could lose my license for that. So, and I say this all the time, nobody's case is that juicy for me to risk my license over. I think stuff like that makes people more comfortable talking to us because they know that we're professionals. So we're going to keep that. So yeah, we haven't necessarily had any issues or significant concerns that if we were to, eventually when the private practice is in full swing, that people will shy away from it because they don't want it. That's their business.
And I think even so, we both actually currently work for the same practice, not our private practice, but we work for the same practice. And I have had quite a few, I have seen a few patients who, like especially younger ones whose parents, I think they see me because of this, because they feel like they could relate to. And then even like every now and then I do meet patients who are Black, and I am trained to do therapy, right? But it's not what I do. So, but I see patients where like I am just offering medication management, and they're like, but I really, really want to see you for therapy because you're like me, you will understand where I'm coming from. So actually, like Louis said, it's been, people have been more open, believe it or not, to seeing us because of where we are from instead of like shying away.
And I'm getting a similar experiences even on the social media streets, that people are significantly more open than we think.
Yeah.
Right. There are the people that just are closed off.
Yeah.
Right. And I think those maybe tend to be the louder bunch because they're the ones that will say, like they're the ones that will tout their opinion. Right. But the people who are more on the silent, they are the silent majority. They're the ones that are reaching out, asking questions. Say, Doc, I'm seeing these difficulties in my child. Could that be autism? Could that be ADHD? And then I'm providing some consultations, some advice for them to go speak to a professional closer to them and stuff like that. So no, more people are actually significantly more open than we think. At least that's been our experience.
Anaya.
So if you don't mind, do you mind telling us a little bit about your personal experience, dealing with children on the spectrum? How did you find out? Did y'all diagnose them, or since you're in the field, was it easier for you, or is it easier for you all compared to people who does not have the professional experience and having to deal with it?
No, like, and that no was the last part of the question. If it's easier for us, I don't think it's easier for us. But so like our first child, we found out that he had autism really, really early, like quite early. Or I should say, I thought he had autism quite early. At the time, I wasn't even a nurse then. He was like in his final year of like graduate school.
So I wasn't the specialist that I
So
am today.
he was not the specialist that he was today. And I remember bringing up the concern to him. And I think, looking back, I think it was the father in him who was trying to
Be hopeful.
be hopeful. So he was like, no, you know, this is not autism. It's probably something else. So I really remember, and it wasn't just him though. So our son's godmother is a pediatrician. And I remember bringing up this thing up to her, and she said, no, Lion, I don't think Lion has autism. If anything, maybe some sensory processing disorder, not autism. I took him to the pediatrician. The pediatrician said the same thing, that I think if anything, he has sensory processing disorder. He does not have autism. So then I kept pushing. So then my dear husband said, you know what? I'm going to get you this testing so you will know it's not autism and we will leave this alone. Then he goes to do the testing and come like, come on. And but I mean, and this was just around the time of COVID anyway. So I think clinical pictures of things looked, you know, he wasn't around a lot of kids. So who knew if, you know, so, well, to come back, yeah. So I kind of suspected things like quite early because I had my developmental milestone thing that I was kind of checking off, and some things were just missing. And I was with him at home a lot, right? So like my husband would tell you that he's never actually heard my son really speak before. He really hasn't. But when I was home with him a lot of the time, he had words. Like he would come to me and it's mama, mama, mama. And when I give him my attention, he tries to say something. It sounds like it's bubbling, but he is trying to communicate, right? And then like he could be in the next room and I'll call him Lion and he will come. And then suddenly that stopped. That was the first thing for me when that stopped. And I was like, okay, this is strange. But I guess he didn't see it at the time because he hadn't even heard him say dada to start with, you know, yeah. So that was a thing. And then he kind of, like I said, I would call him and he is like, he hasn't even heard me. Like I have to be in his face. And then I am in his face and he doesn't want to look at me anymore. Like he's trying to avoid eye contact. So those were the biggest things that we saw that actually led us to see a pediatrician and eventually get him evaluated. And by the time we had our daughter, we had done this before. So when she started doing the same things, we were like, come on.
Yeah, that's it. Like for our daughter, it was more like, yeah.
And we're like, okay, let's just get her an official diagnosis because, you know, so yeah, so we got her assessed too and she was diagnosed. But yeah,
I think so. The part of the, I guess, the process, the raising kids on the spectrum that I would say for us is a little comparatively easier because we are professionals in the field. Is one common thing that I see, especially for folks in the community, is when they hear autism, they picture a certain severity, a certain level of functioning, right? And that scares them, right? And I think because we know better, we can then keep our expectations in check, you know, and also because we know some of the strategies that can in fact help, we're doing that, you know. And again, we're mental health professionals, so when it comes to managing the anxieties and managing our own levels of depression and our own fears and worries, it's still difficult, yes, but I reckon that we are going to be relatively better at that than the average person, you know. So I think overall, you know, all of that makes it a little easier for us than it might be for the average Ghanaian couple that has 2 kids on the autism spectrum. Yeah.
Wow, I guess it really does help as a parent having the knowledge, you know, versus someone who really does not. And again, within our community, I'm glad that you both haven't experienced any pushback, but there are people that I know, that would blame these things on all kinds of things and would kind of like pray the situation away, rather than getting the child the help, the
So
right help.
actually, yeah, when it comes to that, we've had friends who, like, when we told that Lion had autism, said things like, don't say things like that, and Kasantonuso, like he's going to talk, like, so, like, I think that's what the pushback that you're talking about, like, people.
Yeah.
And Lewis always has this funny thing that he says, like, I haven't said he's a thief. Like, I am just saying he has autism. And one of those friends that we have, which I so believe that she's coming from a place of,
No, they always mean well.
she
They always
means well,
mean-
right? But like, she keeps asking me, like, she keeps saying, don't say that. But then she will see me and she's like, so Lion is still not talking. So, and I'm like, essentially he doesn't have autism now. That's weird. Like, there was one time I was like, in fact, if you want, you can call and talk to him and ask him why he's not talking. Like, because so yeah, people do say things like, don't say things like that. But I mean,
Yeah, and that's probably another area where for us it's a little easier, right? Because it's effectively it's my job. It's literally my job. So you're not coming to convince me that my child who has been diagnosed with autism does not have autism, right? So maybe the average person, somebody will say, "Oh, in Casa Antonio, so don't say that about your child. Take them to this pastor, or go and do this and go and do this," and they will be swayed, every step of the way. You're not getting that with us, if you think prayer can solve it, sure, go and pray for my child. My child doesn't have to be there for you to pray for him, right? So pray
No.
for him by all means, but I am not stopping the speech therapy for him to go and lay at Atria Mountains. That's not happening, so those are some of the aspects that I guess overall still makes it easier for us. And on another level, and I don't know if that's more professional or personal, we go where we are loved. We go where we are appreciated, right? So if we come around you and it's in Casa Antonio, so why is this kid not doing that? That thing that the kid is doing is weird, or that thing is like, you understand? Because I'm not like, the thing is, it's hard enough dealing with it on a day-to-day without you making my child feel as though he's not welcome in your space, or making me feel like I have to explain why my child is in your space. I have to consistently explain to you what that is, right? So we have been absolutely blessed to have the circle of friends that we have. But sometimes when we take our kids, them especially our son, when we take them around, our son is doing his own thing. They will not ask one question because they know him, they understand him, and they love him for who he is. They are not trying to change anything about him, right? And when we have that circle, and that's how we roll, if you do one or two things that doesn't quite fit what we expect from our friends and stuff like that, we say something once, we say something twice, by force.
and we actually really like our house anyways.
That's one of the reasons why this is important. This conversation is important to have, because in our community, not just as Ghanaians, as Africans, as Blacks, we just have this mentality that if you're not what we consider to be normal, right? Our quote of what normal is, then there is something wrong, right? You can't be different. You have to be in the norm of what we consider normal, right? So we're thinking, if your child is sick, why is the child sick? Let's go pray for them, right? But you can't pray all sickness away. If your child has special condition, you cannot just pray it away. And that we want people to understand that there are specialists, there are ways that people that God has given the wisdom to be able to help you guide your children in the way that they need to be able to flourish, to be able to live well, right? No matter what the condition is, there are people that God has given that wisdom. So it is God's will, and it is God helping you when you get to meet with that person that can help you in your situation. Right? It's not just, oh, take him to the pastor, miracle happened, God is good, it's done. You know, the fact that you can even recognize that my child needs this help, and God has made a way that this person can provide that help and to help that child. That in itself, it's a blessing, and it's God's doing, right? So we have to get the understanding that not like if you see someone that is on the spectrum, they're not cursed. Nobody did anything wrong, right? So then we don't have to go and fast and pray and wish and pray that God take it away. You know, so that's the mentality that we need to kind of gear away from, and just use your resources, because there are people whose children are on the spectrum and they refuse to go to, you know, get them officially diagnosed and seek help. And they're sitting in churches and places praying and praying and praying. And the children are over there just, you know, getting worse and not knowing how to deal.
Yeah. I mean, faith without works is dead, isn't it?
Right. And we're also trying to, myself and a few of my colleagues, we're hoping to, at some point, do a lot more kind of higher, broader level education, so that hopefully we can get pastors, imams, and community leaders, you know, with information about what some of these developmental delays are, you know, because, I mean, if your child got a cold or, you know, any physical health issue, you will pray for them, yes, but you'd hopefully still take them to the hospital for the doctor to examine them, you know. So I don't know why sometimes when it comes to mental health, it's as if people feel we can't do both, you know. Please, by all means, of course, faith is a good thing. I think faith and prayer sometimes gives people hope, and it keeps people hanging in there, you know. So I would not on any day suggest that people can't pray for their kids on the autism spectrum. Please do that. But after that, go see the professional to do it. We as a Niswadian, like to do the physical aspect of it, while your pastors, your spiritual leaders do the spiritual aspect of it. You know, so I'm hoping that we can get to the point where the pastor that somebody has brought their child with autism to will say, okay, 2 minutes here, and after that 2-minute conversation, go and see Dr. Right. Yeah. So it's going to be the pastors actually directing to us. And hopefully, I think many people respect their pastors a lot. So the person that you think is going to do the miracles for it to go away, the person says, even almost like no, like what you do is to go see, you know, the specialists for them to do the assessment and stuff like that. Hopefully more people will kind of get, you know, that understanding and move with it. You know, one thing I don't do anymore, I mean, I don't think I've ever actually done it. I don't argue. Min will be argue say, if you want to pray it away, I won't argue. Right. So if somebody's, however, very open and wants to ask me questions, I'm open for that, but I'm not open for arguments. I'm not doing that.
Right. Thank you so much. So I don't know if Nanea, you had anything else, but for us to go on to our topic for today, but someone, we will go on to it, but let me just, I don't want to forget. She just sent a message on WhatsApp. She said, I'm so glad that these two are sharing their own personal stories. It's pretty relatable, but can you please ask them? My son is 5 years old. He has not been diagnosed with autism, but there's a part of him that seems just not to understand. He gets suspended from school, yells, screams, throw tantrums, break things. What do they think? Do they think that he could have autism even though the doctors haven't yet diagnosed him with such?
I always tell folks, your best friend when your child is growing up is your child's pediatrician, they're the best person to give you that initial thought, because they know your hopefully like your pregnancy history, your child's history, every step of the way up until this point. So they will be the best people to actually assess and give you guidance. That's point number one. Point number two, there are several developmental conditions. So there's ADHD, there's intellectual, issues, there's autism, there's Down syndrome, cerebral palsy, so many different things that could be going on, But I think autism somehow has, in a way, become an umbrella term for developmental difficulties. So anytime somebody's child isn't speaking, they're going, "Doc, do they have autism?" They're struggling in school, do they have autism? They are hyperactive, do they have autism? And I mean, I'll take the question any day over somebody who wants to hide it, sure. But I want people to know that there's a whole like list of things that could be going on. So absolutely, if you're seeing something consistently that like, this doesn't fit what I expect to see in a 5-year-old or stuff like that, please start by talking to your child's pediatrician, who will then, ask a few more questions, do a little more assessment, and, maybe do some testing to say that it's not a physical health issue, and then refer you to a psychologist or neuropsychologist, the right person to do the assessments and let you know if it's autism or not.
Does that really he's answered the question, but I guess to like the point of this, the question this person is trying to ask is, well, and I think you have, but I guess what I would also add to that is, yes, the fact that the child is doing things that you would not developmentally expect from a 5-year-old, there is an issue. But however, like Lou is saying, the issue may not necessarily be autism. It could be ADHD. Sometimes it's even just anxiety. Like that will let kids act out like that. So there is something, but just this little information that we have is nowhere near enough to say that the child could have autism or not. So that child needs to be assessed to see if.
And for context, when we do the assessment, right, there's a lot of forms that the parents complete. We try to get forms from the teachers, and then many times we bring the child in, so we also assess the child as well. We do an interview with the parent about how the child has been since they were born, depending on the age, right? So if the child is 10, we'd ask questions about how they were, their developmental milestones between 0 and 1, when they started talking, when they started walking, if they've had any regression, as in that's what Laurencia was describing, where they start doing something and out of nowhere it seems to stop, how they engage with their peers when they started preschool, kindergarten, how they do it now. So we ask all of these questions, so it's a lot of information that we need to gather to be able to say that, yes, this child has autism, right? So it's not a diagnosis that we come about lightly. So definitely, like I don't think there's going to be enough text that anybody can send over these spaces for me to be able to say your child has autism or your child does not, right? So that's why it's important to, go through the process for, your pediatrician to tell you, okay, this aspect is delayed, this aspect is delayed, these symptoms fit with autism, so let's go do autism testing. Or, actually, these symptoms don't fit with autism, it fits more with ADHD, let's go do ADHD testing, right? So, yeah, for the person, please reach out to your child's pediatrician and start that.
Thank you. Nana, are you good, or you want to come in?
I do have a question, just to piggyback on that and from the beginning. When you were talking, Sister Laurencia, you said for your son, he was saying some words and then he just stopped. I have heard in other situations where, for the children that are now nonverbal, they started out talking, right? And then they just kind of went away. Is that like a regular thing? Or because I thought in the beginning, that if you are, if you're on the spectrum, it's from birth, like it starts from birth. But I guess I'm
think I kind of understand your question. Like, so, like, if you have autism, you were born with autism. So how come you started?
That's what I thought. But then it's like you can develop it later on, or how does that?
Yeah.
work?
So what it is he does not like, and I think this is one of the things that Lewis was saying, that when they do the testing, they look out for is regression. So regression is one thing that is associated, like
It's very, very common.
hugely associated in kids with autism. So I guess it's just a thing that's there. So it doesn't mean that he just got the autism out of nowhere, but like regression is a thing, right? And so I guess that's why it was like the biggest red flag for me, that they start doing something, they have a skill and nothing can explain it. That's what the regression is. So let's say if we had moved to a new place where he didn't know anybody and whatever, and he stopped talking, then we could be okay, like there's been a change. But it was so random, like out of nowhere. So yes, and I actually really understand your question. I just
let me see if I can help there.
Yeah.
So the symptoms of autism by its nature evolves, right? Just the nature of the symptoms itself, it's not like a fixed thing that it will look the same every step of the way from birth. So depending on their age and what's going on in their lives and everything else that's going on and what support they have and stuff like that, different aspects of the autism show up significantly as they go along. So there may be some people that sometimes like maybe their parents will not even know they have autism because the symptoms that they were seeing when they were younger were manageable. Right. So I'll give you an example. And we typically see that in young women, if they have language and they are smart enough and they're doing okay in school, even if maybe they start preschool, they start kindergarten and they are socially struggling, parents would think they're just shy, right? Even if they have kind of sensory issues, they will say they're quirky. If they are picky eaters, again, they'll say, oh, my child is such a picky eater. But those are all some of the symptoms of autism, right? But they're explaining it away by saying they're shy, they're quirky, they're picky eaters, or they're rigid. If this child has certain rigid expectations, they will say they're rigid and explain the symptoms away until maybe the kid is 10 and, maybe they are moving from grade school to middle school and the transition is so difficult and is so drastic that they start having meltdowns and they start having significant sensory issues. They can't stand when their kids who are now middle schoolers are noisy, and so they're struggling in class and the academic work is getting more difficult and they can't keep up. Now it looks a lot more problematic. So it might look like the autism is now showing up, but no, it was always there, except that when they were younger, the symptoms were explained away, or the symptoms didn't cause too difficult problems. So that's how sometimes it looks like, so I don't know if that helps, so they didn't get the autism later. The symptoms were always there, but the severity and the intensity, because they vary, it got to a point where everybody's eyes came on it, but typically when we assess, we look back and we ask the questions and then we go, yep, it was always there.
Yeah. Okay.
And
So it's not developed later in life. It's always there. It just regress, as you're saying.
And I think another thing I could say about that is, like when they've done this whole test and somebody's diagnosed with autism, right? Autism spectrum disorder by itself is the diagnosis, right? And then there are people that have either like language impairment with it, right? Or they have some kind of intellectual whatever with it. And Lewis is like, that's his shtick, so he can give you that. But so even if Lion had not stopped talking and he was still talking, he still has autism, but he wouldn't have the accompanying language impairment with it. But then does that make sense?
So let me speak to that. So I think many people misunderstand what autism is, right? So we can't get into it too much today, but there are the set of symptoms that are specifically about autism, And anytime we assess a child with autism, we need to then state if the child also, in addition to what the autism, has verbal, language impairment. So that's why you hear people say things like, I have a child with autism and they are nonverbal, right? You know how they would say autism and then nonverbal, because that's a slightly separate thing, right? Because if being autistic automatically meant being nonverbal, then we wouldn't need to say that they're nonverbal, right? So yeah, so yes, we say they have autism and then we say whether they have language impairment or not. We say whether they have intellectual impairment or not, and then sometimes also if the person has other conditions such as Fragile X syndrome, Down syndrome, cerebral palsy, other medical things that may make their presentation severity even more difficult, we speak to that as well. So those are all kind of the different things that typically accompany autism. So sometimes the child might have autism with language impairment. 3 years later, they're speaking and there are no language issues, and that's when you hear people say things like, my child's autism is gone, just because now the child is talking, right? The autism is still there, except that now they don't have language impairment, right? So that, it varies so much. One of the most common things that we see in individuals with autism is difficulties with change and transitions. So a child could look like they're doing fine, and then they need to move from preschool to kindergarten, and that change can throw them all the way off. So I struggle very much with people who get parents hopeful and tell parents your child's autism is gone, because now the usual strategies that they would have put in place to help their child's transition, they will step back thinking the autism is gone, right? And there will be such a rude awakening when their child is struggling with the transition there. So there's so much to learn and understand when your child is in fact diagnosed with autism. So yeah, it's a continuous learning process, and we're doing our bit to help in our community. Yeah.
Wow. I'm actually sitting here thinking to myself, I guess every human being could have some type of autism without us knowing.
A little bit somewhere.
Okay.
No.
Right. So that's what I'm thinking. I'm like, wait.
So
because I'm like, with everything I'm hearing, I'm like, wait, does it? Could it be? But isn't that a good? A good thing to think?
No.
Okay, go into it. Let's talk about it.
It's not, because. So let's put it this way.
Okay.
Even though we say autism is a spectrum, right? The spectrum starts somewhere, right? So you think about, let's do numbers, right? If we need to score behavioral things, and we say anybody from 40 to 100 falls in the autism spectrum. So there might be somebody whose autism is a 41, relatively mild, and another person whose autism is 100, relatively severe. So that's where the spectrum is. And those two people can look very, very different, right? However, if you are 20, you don't have autism. You may have some behavioral issues that can be similar to somebody who is a 41, but you don't have autism, and you don't have a little autism. You don't. You're nowhere. You're not in the spectrum, right? The person who is a level 1, who's a 41, has a little, and even that, like the person who's a 41 has a little autism, but you are 15, you are 20, you don't have a little autism.
Just relax.
But if you're 20, you're still there a little bit.
Even if you're 39, you're not.
You don't have a little autism.
I'm thinking you have to be 0 to not have it at all, right?
No. So since if the spectrum starts at 40, you would have to be
40 to have to be
at.
Okay. If it starts at 40, you have to be at least 40.
Okay. Thank you for clarifying that, because I'm just gonna get off this show.
Some of the downsides to everybody has a little autism. In a weird way, I know that many people, when they say that, they mean well, right?
Yeah.
But in a way, it sort of also kind of minimizes the people that actually have it, right?
Yeah.
So we're raising 2 kids, and they're actually quite different. I think our daughter, many people people who have met her don't think she has autism. They don't realize until we tell them, right? Because
you engage with her.
You engage with her, because she has a few more words now. And she's a bit more social than our son. and he's not hyperactive too. So people's attention doesn't come onto it. But she is lower on the spectrum, right? But raising even her who has a little autism, when somebody comes to tell me that their child has a little autism because when their child is watching TV and they try to talk to their child, the child just ignores them. It's like, you wouldn't name the identity.
Yeah. You don't know what you're talking about.
Like, because sometimes then it almost sounds like you are trivializing. You understand? So I know many people mean well when they say, everybody has a little autism, a little ADHD, or even a little OCD or stuff like that. But if you understand those diagnoses and how severe and impairing it can actually affect somebody's life, you don't have a little, like, but it's almost like, let me not do that. Let me not do that.
No, don't do it. Don't let intrusive thoughts win. But and I think we also come at it, like we said, people say that, and they actually kind of mean well. They're trying to say that, like, it's okay. We all have a little bit, like, don't worry about a child. But I think for us as clinicians, when somebody comes to our office and says, I want to be, like, for me, like, I want to get stimulants because I think I have ADHD or I think I have autism. For me to actually give you what you need, you have to meet criteria for the thing.
Okay. Yeah.
And if you don't meet criteria, if you tell me that I have A, B, and C, and I tell you that you actually need D with it too, and you're like, well, but I have a little bit of it. Okay, except that the little bit of it, it's not it.
Okay.
So can't. So for us as clinicians, like, it's, you don't have it. Like you know. So
So I think now.
Let me see if I can put it nicely. Now I'll do it in Chi. So, more fun, Chemi. Say.
We'll always translate when you're done, just for the sake of us. Oh.
So LadyMary. So Tia for a long time. Sorry, why you weak? In fact, to train you create to. I say, a little cancer.
Right.
Oh, you can say this in English. That's okay.
I say, a little cancer. Doctor say you would need cancer, would need cancer. Even though symptoms be more cancer at how when you know. Yeah, will biopsy near they say we need cancer, we need cancer. Cancer or little cancer, and that's more the big C,
I see.
What did they make?
Yeah.
The reason I didn't want to do that is because I feel like
it's
the big C is such a to me
that's
that makes sense.
That's the idea.
That makes sense. I mean, we've said a lot, and for me, I'm glad because it's given me so much clarification on things. For the sake of our topic today, can we go into the sensories?
Oh, we actually haven't touched that.
Right. Now, so I think you're asking, does any child that has sensory issues have autism?
Right.
And the short answer there, once again, is no.
It's kind of like going back to that having a little.
Yeah. And that's a nice segue for us to talk about the actual symptoms of autism, right? So there are, as psychologists, when we are assessing for autism, there are 7 symptoms altogether. 3 of them are social, right? The social symptoms, that's first one is difficulties with what we call social emotional reciprocity. If the person's engaging with you, how smoothly it flows. If you're having a conversation with the average non-autistic person, for the most part, it flows. Even if they're meeting you for the first time, there's a little bit of fluidity to it. And the more comfortable they get, the easier it gets. But there's a basic level of flow that just happens. For kids with autism, that isn't necessarily present. Then the next one is difficulties with non-verbal, cues or non-verbal aspects of communication. Either it will be when they're talking, they don't know how to modulate their own volume. They, like as we speak, there's almost like a singy-songy vibe to it. Sometimes they don't know how to do that. The conversation can be monotone. And then, like non-verbal things such as, might sound like this, if you make a point and say, Lion, go and get that for me. You're pointing to something, you think the average kid looks at the direction you're pointing to and find him cry. So those non-verbal difficulties is something that we need to see in individuals with autism. And then the third one, which is, for me, I almost see it as a consequence of the first 2, difficulties developing, maintaining, and understanding relationships. Individuals on the autism spectrum, you can tell them, this is your uncle. As long as they don't live in the same house and have that relationship with them, it doesn't quite register that this relationship means there should be this thing, minimum, and for many of them also, as they get older, they don't do quite well with building relationships. So they're always going to be at the outskirts of friendships. They make friends through friends. Maybe my siblings' friends become my friends and I hang out with them. Because of some of the difficulties that they have, they'll be the kids that if there's a party at first grade, you have to hunt the parents down for them to invite that kid to because of that. Stuff like that. So these three social issues have to be present before we can diagnose autism, right? And then at least two of the four that I'm about to mention, would the Becca three and say I diagnose autism. The four that I'm about to mention, one of them is sensory issues, right? So there might be somebody who has autism who has these three, and then two of the four that sensory issues is not included, and they still have autism. And then there would also be somebody who has sensory issues, but none of the three that have to be present, and that person doesn't have autism. So the four that we need to talk about is sensory issues, and there's something we call repetitive behaviors. So you may see a kid doing certain things, whether it be with their body or with their language, that is so repetitive, and you're like, why does this kid always do that? Maybe Autihona, finger tapping and rocking at the same time, or hand flapping when they're excited, stuff like that. By itself, it's not necessarily wrong. It's just so repetitive, and to you, it doesn't serve any purpose, right? Those are the repetitive behaviors. The next one is rigid patterns of behavior. They struggle with transitions. Like if we do something a certain way, that's how we have to do it. What's a sana ahami? Right? My daughter like this, if my daughter is in the house and you turn off the light, a light, and she sees that you turn off the light without asking her to turn it off, problem. So she will come and turn on the light, and you would have to tell her to then turn it off, right? If it doesn't happen, we are not sleeping today. Right? To the average person, it's like, why? You were not here when I was turning it off. The fact that you knew earlier that it was on and now it's off, you have a problem because you're like, why didn't daddy ask me to turn it off, right? So those rigid patterns. And then the last one is restricted interest. They can be so interested in something that they would know so much about the thing. And oftentimes every conversation comes back to that, and it's one of the areas that for some people that know about autism, or some people whose kids have some of those interests, they will say that kids with autism, like autism is a gift, because sometimes kids with autism can have those interests and so will be very, very good in that area. So you may see a kid who's a very, very good piano player or a very, very good math student, and you're like, oh, autism is a superpower because it's autism that has made him really, really good at math. Is it a superpower? I don't think so, right? Because oftentimes the restricted interest, it's usually at the point of ignoring other things, right? So those are the 7 symptoms. 3 of the social have to be present, and 2 of these 4 that we typically call repetitive or restricted behaviors have to be present as well. So that's what to say about, so somebody can have sensory issues but not have autism. And also, LadyMary, sensory processing disorder is a thing in itself. So a child can meet criteria for sensory processing disorder and they don't have autism. So I guess that's a long way of saying not every kid with sensory issues has autism. Yeah.
Nanaya, do you have a comment or question?
We told you that if you ask us questions, we would talk till tomorrow.
I could do this all day.
I love it.
Do you want us to look at managing? No. Oh, you were talking. Sorry. Come in then.
No, I was just telling them that I love it. We need to hear it.
Okay. Do you? It's really actually good to have these type of conversations, because you might never know who is actually listening. Okay, maybe the person might not have been or gathered the ability or the vim to actually come out and speak to somebody, because there are people that are, within our communities, people that we know that could be afraid. And we thank God that more and more and more people are coming out or feeling comfortable just because, now there's more education ongoing. And I'm so glad because I think last 2 weeks, was it last 2 weeks that Auntie Mary came on The woman that does my journey, the journey with autism, Nanaya's mom. And I mean, her story is just amazing, you know. And so having people like her creating awareness, and actually, I saw that she was saying something today or yesterday that now she's actually working with some of the top hotels in Ghana to where they are getting some of the children or individuals that are in, you know, that are experiencing autism to actually get them a job. You know, now people are starting to understand. And I think that with more and more education, it could be better. We know that those that are in the Western world, it's okay. Someone can have or be on the spectrum and then they can have jobs and things like that. I work with a man who had a hearing, you know, issues, but amazing man. So, but from where we are coming from, these things are not there. So I'm glad that with what you do on TikTok, with what everyone else is doing, gradually we would get the understanding, you know, and make sure that.
Because even in these countries, you still have to know that you have a right to fight for it, because
Yes.
nobody is giving you the job just because you have autism. You have to know that I have a right not to be discriminated against.
Yeah.
And fight for it. Yeah.
Yeah, but you know, in some of our places, the law is in some people's pocket. Okay, let's go to the topic. Can we talk about managing?
What you're saying, like over here, they do have, you know, things in place to specifically cater to that community and the individuals who has autism, right? But it's not the same where we're from.
Yeah.
You know? So these conversations help. And then, you know, especially with this lady, Auntie Mary, being, you know, I can see how it's difficult because it's like you're literally a one-man shop, you know, trying to bring awareness where it should be more of a country thing, you know, starting from the top and creating opportunities and creating making resources available, you know, for everyone, because they are also citizens of the country. You know, you have to make accommodation for everyone, but it's not.
Yeah. Are there different type of sensory issues that we can look at and then look at how to manage them?
Yeah. So, I mean,
I think like when it comes to sensory issues with autism, there are kids that are hyper reactive to some sensory input, and there are kids that are hypo reactive to sensory input. I think our daughter is actually hypo reactive.
break it down. Break it down.
So like, how do I even explain this? Oh, babe.
That's my superpower. They're breaking it down.
Yeah.
So when it comes to the sensory issues, there are people for whom even the slightest. So let's use sound, for example. There are people that even the slightest sound, if it's a sound that they don't like, it's a very low version of that sound, but to them it's way too loud, right? So for example, at some point for my son, you turn on the microwave and and it says it's not so. Like the microwave sound that is so quiet that most people can tune it out. For him, that's too loud. So he is hypersensitive to sound, right? He's very sensitive to sound. So he's hypersensitive. But even that same person, when it comes to touch, like almost like he's always seeking stimulation for his mouth, his lips. So he's hyposensitive to lips because he needs more or more. Like what and so, you know, so that's sort of the main, you know, the hyper and the hypo. And then we can really take these two things across touch. So there are some people that some certain textures, if it touches them, it's like, oh, that's too much. They're too sensitive to the texture. And there's some people too who need very, very heavy things on them, you know, so they use like weighted blankets and stuff like that, and that makes them feel good. So they are hyposensitive to pressure, you know. And then you can come to things like food, you know, there are certain textures that for some kids, like if they see it, if it's anywhere near their mouth, ew, that's too much. You know, and then there'll be certain textures that they want more of, you know. So we've talked about taste, we've talked about touch, we've talked about sound, and we take light too. There are some kids that's with these bright lights problems, like it's too bright, dim it. So still some other people that would go to places wearing glasses, you know, even inside, and it's not for fashion because lights are too bright, and it's too much for their eyes. Then let's talk
And
hearing
I think
too.
even when it comes to pain, because like our daughter, if our daughter ever cries because she's hurt, she must have been very, very hurt. Because
she's hyposensitive to pain.
She can hit her hand and not deliberately. She doesn't like go seeking sensory input from that, but then like she'll be doing something and she can really be hurt, and we are like, ooh, and she goes like, when she didn't have words, it's like nothing has happened. She just walks away. These days that she has words, she can actually tell us it's okay. Or like there's a cute thing that she says now. Everybody gets hurt sometimes, and she just walks away. And so she has, and then when it comes to like she had a wobbly tooth, right? Her tooth was coming out. It bothered her so much. Like she could feel everything. At a point, she told me like 3, 2, 1, blast off. Like as she get
yank it out.
As she
We didn't do that.
We didn't do it. But she really wanted us to yank it out because she was
irritating.
Really, really bothered by it. Meanwhile, our son had a wobbly tooth, and he wouldn't even let us touch it to try and wobble it for him. So, yeah,
that's how different things can be with the kids on the spectrum. So that's where the actual spectrum is, right? Because it can be so different.
Yeah,
it can be so different. Even the same child can have such different things, because the same kid that has a wobbly tooth and doesn't care, our son, is the same person that little sounds.
Right.
He wouldn't, if he sees an elevator, he tenses up.
Oh yeah.
He can't stand an elevator. You take him into a public bathroom, the little fan, the dryer thing, he can't stand it because he's hypersensitive to those. So sometimes I think bringing it back to, I guess, managing, sometimes it comes down to knowing the things that your child struggles with, and as much as possible, avoiding some of them that you can avoid. And if you're going to have some of those things around, you prompt them if you can. Even though our son doesn't have a lot of language, every time when he was really, really sensitive to the blenders and stuff like that, every time we're blending something, we have to say, "Hey, Lion, we're about to blend something."
And actually, the fact that he knows
it's coming.
Yes.
He does
a lot better.
Sometimes he will still close his ears, but at least
he doesn't startle so much.
He knew it was coming. So sometimes that's all you can to preempt some of those things. Yeah. And for parents, for example, like if your child struggles significantly with the texture of certain foods, I would recommend don't force it. Find different, if it's about nutrients, and if it's possible, try to incorporate different things into their food to get them that. Don't force it, because a way it has been explained to me is, like no matter how somebody describes sand to you, if somebody says sand is, if somebody tells you sand is food, and you put it in your mouth, you still wouldn't eat it, right? So sometimes it's been described to me like it feels like sand in their mouth. So no matter what you call it, it still sucks in your mouth.
Yeah.
Right. So sometimes you have to try and find different ways to get them the nutrients and experiment with different foods and stuff like that. So, like if your child is the texture of banana, don't keep buying it and say, "You will see, I'm the father. I will show you. You eat banana."
Eat banana.
Wow. My son is 7, and I guess this is what I'm thinking. I'm trying to think through this. I took him to KIP. You know KIP, right? Both of you. I don't know if you know KIP, but it's on the north side. And everything, the system, the toilet seat and everything seems to be super modernized. And I remember one day the teacher, they called me and said, your son wants to use the restroom, but when we take him in the restroom, he runs out and starts screaming. Come to find out, it was a modern one that as soon as you jump off, it flashes on it on, and it had that loud noise. And so I had to go to school, pick him up, bring him home to get him, because even when I got to the school, he would not go in there. But then as we were talking, I'm just thinking through some of the, scenarios and things like that, just to be able to see. I say this to say that if you're a mom, with everything that is being said today, or if you're a parent, grandparents or what have you, and you are experiencing, or the child is, exhibiting these signs, don't be so fast to conclude on them, because some of us, our parents will literally scream at you, yell at you. In fact, some of them will beat you. You get some whooping just because, you're not able to comprehend, and they don't also understand why that is happening. So as we were talking and having this conversation, and with everything you both are saying, I'm just sitting and processing everything that, okay, then we need to really start looking at things differently. If you're home, or if you're a babysitter and someone's child, you're blending and they're screaming and all that, hey, go on a those things. So I think that I like the conversation, I guess, is what I want
I've
to
always
say.
said that if we ever took our kids to Ghana, they will do deliverance on them.
Because they will say we have spoiled them.
Because like Lion, I cannot imagine taking Lion to church with all the drums. And we used to take our son to church, and he couldn't. It was like the sensory input was so much. He couldn't. Like every time we went to church, Louis had to take him outside because it was too much for him. So I cannot imagine taking him to Ghana and they start praying and he starts fasting.
Yeah.
They will say the
the spirit has come.
Yes, we were actually talking about that last time.
When
Mary was on, about the churches making accommodation, realizing that there are different types of people that comes to church, and our churches are loud. Even for like
super
everybody
loud.
Is loud compared to somebody that's sensitive to that sound. So just realizing that, okay, let's get some noise canceling headphones. Let's, because for you said, I used to take my son to church,
Oh, yeah,
so
he doesn't go to church no more.
What are you now? You don't, right?
But I keep him. I stay home.
So
they still go to church.
I still go to church. I don't take my.
There's no point for me and him to go to church, and only for us to spend the time outside.
Yeah. But then it would be helpful if they had like some noise canceling headphones that he can, at least so he can, have that experience, or just go and see if he likes it or he doesn't like it, just by providing that accommodation. So we have a long way to go to.
Or even Nana, even with him, I mean, they're adults and they're parents and they can keep their child with them. But how about the Sunday schools? The teachers, how equipped are they? The training. I think that we need to really start looking at all these things. The churches, ways where the Sunday school teachers are being properly trained to also understand all these sensory issues and the spectrum, the different types there are. I know that I think.
Because rumor has said that even like classroom teachers don't have
in Ghana,
as much knowledge about some of these things, right? So Sunday school for we are doing we are doing too much. So we obviously need to get there. But because sometimes also when you try to do too much too quickly, you burn yourself out.
But you know that those, and I was speaking to those of us that are in the Western world, at least, at least. But I don't know if your churches have it. My church don't have it. I don't think the African community churches have these structures in place.
Mine either.
I don't. If they do, I don't think it's probably like a handful. And you can imagine how many churches that are being run by our own people. So I was referring to those that are actually in the Western world or developed world. I think that these things should be structured. Yes, those in Ghana, like you said, yes, we understand it's probably going to it'll take forever. But at least once you are in this country and you know the rules, the laws, and the inclusiveness and all that. So I think that something can be done. I don't know, something.
But that's why we have these conversations, because like honestly, it didn't even cross my mind. Like before this conversation, it didn't cross my mind to say, you know what, maybe we do need to get some noise canceling headphones. It's through this conversation that dawned on me, like that would be helpful. To kind of get something like that. You know what I mean? So it just through conversations and awareness, because we can't. They might just not know because they haven't had the experience of having to deal with someone in that situation that they have to make an accommodation for. So we just kind of move on in life thinking that we're all the same. Right? Yeah.
So how do the last thing we want to look at? Let's look at the developing and independence, if that's okay.
Yeah,
Can we look at that?
Mhm.
Because I think that's also an important part. I'm not sure how. Nana, take over. I'll be back.
So I think Anna is supposed to magically know the question
Just, yeah.
that she was going to.
But
I think one of the kids came in.
no, so I think LadyMary was asking about, I guess, helping your child develop the independence.
While still keeping them safe, which is something we always talk about in this house. Like, you want, at the end of the day, you want your kids to be independent, do things without you, but you also have to keep them safe, right? So it's about finding like a good middle ground. Like our daughter, for instance, she's at the stage now that she's trying to get that independence. Like, so if she wants a snack, she's trying to go to the pantry and get a snack for herself. Even if that means standing on a chair and getting to the snack that she wants, so she wouldn't call anybody, even if she wants water. So we try to allow her to do things like that, but there are some other things too that we're like, absolutely not. You are not allowed to have independent. Like there was a day she tried to get into the medicine cabinet. She wasn't looking for medicine, she was looking for something else, but that thing is where the medication is too. So then we're like, no, like, because she does not really know what is medication and what is not. So,
or even understand the concept of medication, right?
Yeah.
Because when you try to give, hi Clara, when you try to give her brother medication, she would come and say she wants some too, right?
Yeah.
So in her mind, medication is probably
No.
something that we eat or drink, you know.
Yeah.
So where the medication is an area where no matter the independence she wants to build, we are not letting you practice your independence there. You know.
Yeah.
However, like the pantry, feel free, you know, and any like as they get older and as they develop new tricks, we have to also, you know, so we're always moving things up higher, you know, because now that she can stand on a small chair, that's where she can lift. The things that she couldn't reach before, we have to, now she can reach them. So we have to move a few things up a little higher so she can't reach them. You know, in our house, we have so many kind of safety things in place, you know, because our son, for example, doesn't have a good sense of safety and danger. You know, if the door is open,
He's going out.
he's going out. He doesn't care to come get mommy first. Like these days, another thing that is very common in kids with autism is something called elopement, right? You may be working with them, you know, on average, if you're working with a 7-year-old, you don't have to hold their hands. You just, because they will not just run off out of nowhere. Our son, if he's, at the time you're working with him and he gets the thought to run for whatever reason, he'll settle. Right. And if you don't take care,
And he's so fast.
if you don't take care, he's gone. Right. We are lucky that we live in a cul-de-sac, so we're not close to the street. So you can chase him and you catch him before it gets dangerous.
But even before we had a fence, there was a canal behind our house. He almost ran into the canal.
Right. You know, so it's little things like that. Then you have to put as much as possible, invest in things to keep them safe. Right. So we have cameras at places so that if you don't have eyes on him, it's not every day that like I could be down here.
Yeah.
I expect him to be in the room up, and I'm not hearing from him. Just check camera, and then, you know, whatever I need to go do that. Right. We have, you know, not alarms necessarily, but we have things in place to keep the doors locked. We have, you know, things to cover the door so that they're not going in and out of places that we don't expect them to go there. Right. Because our son in particular, right? And if you don't take care, now you're upset. You know, these days, right now, we only have like one TV left in the house. Everything else is a projector. Because we're Papa Nina. Right? And Obabona Kusise.
Yeah.
Right? There's no point buying a new one and leaving it as it was, hoping he won't break it.
Yeah.
Because break it, and now both of you are angry.
Yeah. Okay,
You know, so now, like, it's a projector. It's a projector that he can break. You can hit the ball, but there's nothing to break, you know. So it's small things like that to keep them safe, to keep us sane,
Yeah.
while they build the independence they can build. The small areas of independence for them really comes down to time. So for example, if it's time for them to eat dinner, and or let's even use breakfast. If they need to eat something before they go to school, and you wait until it's 5 minutes to go to school, then you'd have to shove the food in their mouth, right? Because if you leave my daughter that she should practice independence and eat before she goes to school, it's a 30 minutes conversation. We are often will be in a born miscongeniality. Right? So if you have a time crunch, that means that you have to feed her.
You have to feed her. Mm-hmm.
So if you want her to practice independence, which is good, that means that you also have to always plan your time. Or the morning breakfast feeding, you feed her. Dinner time, you give her time to practice with it. So you take advantage of the small opportunities that has no rush to them to help them practice their independence. But above all, of course, you keep them safe. If you see any small loophole that they can exploit, please invest in sealing that, and stuff like that. But yeah, that's what comes to mind for the.
And I mean, and it gets expensive too, because like how we're telling you that, like, our son Lion's like always seeking like things in everything, edible, non-edible, like it doesn't matter. And I think for him, the texture, if it feels sandy, that's his go-to. So like if I give him Gary, he will chew it, like he likes it. So he will go to the backyard and you expect them to just be playing, and he comes back and he has his mouth is full of sand. And like their little play area, Louis actually got artificial turf to put there, so there is nothing there for him
there's no sand for
no sand. And then he moved out to another place, so now he has put turf at the whole place, like, so there's nothing to get to, which is very expensive. I'm like,
it's expensive, especially if you want to be sane. It's very, very expensive, so some of us, we can't build mansions in Ghana
because
we are building our mansions. Our mansions here.
The kids are
manage somebody's behavior.
We're actually using the mansion money to manage behavior.
And then, because the door to the basement where my office is, I had to get a fingerprint lock to it, right? If it's a regular door that's can open from outside, you can tell them 1,000 times not to come here. The only way you can honestly get him, especially from not coming, is Obona, right? And that's not how I'm trying to. That's not how I want to raise my child. I don't want to in fear. That will maybe no problem.
Because the funny thing is that even though he seems not to, like, when you tell him something now, he understands, and like in 5 minutes, he's forgotten what you told him. However, when you beat him small, he doesn't forget. The next day you try to go to him and he's running away. I'm like, this thing was yesterday. So then it's gonna have like so much fear and so much.
And he probably can't understand why.
Why?
Hurting him. Why you're hurting him. That discipline you have to kind of figure, understand.
Yeah.
How to discipline them and not have to like result to hitting, because I can imagine he's probably like, why you just hurting me?
What's going on here?
How you doing?
So it's expensive, but then like also like the independence, like I think exactly like Louis said that like he needs time. Like when we are taking him to school, there are some things he can do. Like if you tell him to go get his backpack, if you tell him to go get his shoe, except the problem is that he will get one shoe, like one out of the pair, and bring it. And then you have to tell him that, put it on. And then he'll put it on. And then I'm like, Lion, go for the other one. And actually, it doesn't matter that the first one he brought is black. If he goes on the other one, he sees is brown, he'll bring the brown. And I'm like, do they match? Do they match? So then I literally
you need a lot of patience.
So then I literally have to go to mad room with him and tell him, okay, you need black. Then he'll pick the black one and break it. Like, and even our daughter too, when we're taking her to school, we just start early. So we tell like LJ, go get a snack. and she would go get the snack. Go get your water. She would go get it, put it in your bag. Now zip it up. It's a whole thing that you try for them to get their independence, but it's also something that you have to work on. Sometimes I'm like, if I had done this, we would be finished. But
Yeah.
Many days, many times, like if you're running late.
If you're running late, that's not a time.
Do it and buy your piece, right?
You're running late, you have to invent your independence.
So we just try
but then many times when we have time, then we do. Because we, as much as possible, I try to have fun with the process. Because the alternative is like every day it's all stress, right? So like sometimes I feel like, they don't get uncomfortable, they just think we are weird. Like sometimes we laugh at our kids, right? Not in their face, like other people. We have fun with it, right? Because once they are with
I know when we are telling them about our friends, they look at us like, are you like, why are you people laugh?
Once they are with right? So sometimes legitimately just have fun with it. And the good thing about them is they're really happy kids.
Yeah.
Right. So as long as they are happy,
they're good.
They will take it one day at a time,
Oof. Wow. Thank you so much for doing this with us again. They say children will teach you patience. And so it is definitely true. Yes, right. So I pray and hope that if you tune in to listen, you've learned something. We are all learning. So is there any last words you want to give? Someone posted a comment on WhatsApp. She says, LadyMary, can you please ask them? He mentioned the son wanting everything in his mouth. Does that mean that a baby who is about 2-year-old always wanting something in her mouth? And it could be anything. She could eat paper or whatever she get her hands onto. Is that a possibility?
What is the sensory motor stage part?
So apart from the fact that it's probably developmentally appropriate, we've also touched on the fact that if anything, that is just one of the many symptoms, right? So ultimately they have to, speak to your pediatrician. The good thing is if you actually if you go to your regular visits, and you tell your pediatrician, hey, my kid is 2, but they're always putting A, B, or C in your mouth, then the pediatrician will tell you, oh, like that at this age is suspected.
Yeah.
And if they're still doing it by the next visit, then maybe we do something about it, So I tell folks all the time, when your child is growing up, don't miss their visits, and don't lie to the pediatrician. Don't feel as though when you say it, they'll think you're a bad mom or whatever it is. If your child is not doing something, tell the pediatrician doing it. If they're doing, something too much, tell them about it, because that's how they can guide you the right way. If you go and lie, like, why would you go and pay somebody to then lie to them? Then you don't have, So, in the spirit of, I guess, last things, if your child is actually diagnosed with autism, I think for me, one of the things that almost turned things around for me is one, I stopped trying to raise the child that I thought I'd have. Because we'll be like anytime you're pregnant or you're expecting, or even before marriage, when you think about your kids, you have a picture of what that kid will be. And I don't think anybody pictures that kid to be a child, a child, especially somebody who themselves don't have autism. I don't think they picture that kid to be a child who has autism and is nonverbal, etc. Right? So you have a picture of the kid in your head, but you need to let that go and raise the kid in front of you. Right? And for me, that was a huge turning point, to try to raise the kid that I have, and then also make it about the kid as opposed to your reputation. Because some people have said that it's not because the thing the kid is doing they don't like, but if people see LadyMary and LadyMary, oh yes, your reputation you're trying to protect.
Yes.
And many times what the kid is doing may not necessarily be wrong. It's just quote unquote weird. And you don't want people to think your child is weird, and now you're giving them pressure to stop the thing, and you're frustrating yourself and you're frustrating them, So there are many things that, again, if it's not inherently harmful, you will not hear me fight my child over some of those behaviors. I'm not trying to impress you, right? If my child is happy, I honestly don't care what you think about it.
Yeah.
I
And
like
those
that.
are the small things that help us kind of get the day-to-day of it. You know? And in addition to all of that, there are times when Charlie, it still hits you.
Yeah.
It hits
Yeah.
you.
We're human beings.
It hits you. You feel what you feel. If you need to cry small, you cry small. You keep it moving.
Thank you for being honest about it. There's a last comment on YouTube. I just projected it.
Too much sweets can make kids hyper.
Mm-hmm.
Sugar
Yeah.
definitely makes
So,
yeah, exactly. Too much sweets, sugar, soda, and those things can make kids hyper. Now, does that give kids ADHD or does that give kids autism? No.
Okay.
Yeah.
But it's not. But then it's not a good thing then.
Too much sweet.
Yeah.
Apart from the fact that too much of everything, apart from the fact that too much of everything is bad.
Is bad.
Sweets definitely not good for them.
Not good
right?
For anybody.
So I mean, if you are consistently giving your kids sweets and soda and the likes, so especially if you find that they tend to be hyperactive, they struggle to go to sleep on the days that they get that much sugar. Of course, try and work on reducing those. And I mean, on the baseline, I think if you pay attention to and improve your child's diet, you will see significant improvements, regardless of what your child, if they have ADHD, autism, or even they're neurotypical. If you pay attention to their diets and give them that they are missing naturally in their diet, or that you try to get them everything, you try to get them healthy things, stuff like that, they're definitely going to do better, right? Because that affects their GI stuff, so it reduces constipation. It probably help them sleep better at night because they are not hyper and wired and awake. So definitely diet can help significantly. Absolutely.
It will not take away the autism.
If they have autism, it doesn't mean the autism is gone, but they can do significantly better.
Do well.
The reason we're saying that is for some reason, there was a video going around of somebody who said that they used diet to reverse their child's autism. And
people
are latching onto it. Like, show me the diets to help reverse my child's autism.
Yeah.
And I feel ahead of time, I feel bad for these parents who would get a rude awakening that the diets can probably help your child significantly improve their sleep. If they have constipation, it would hopefully reduce that and all of that. But autism name because again, language and sleep issues aren't symptoms of autism to begin with. Right? So if you cure those, you haven't cured autism, but those are the small conversations that we always have. And hopefully people hear us.
I guess what I would say to end is that if you are a parent who has a child on a spectrum, know that you did not do anything wrong. You've not been cursed. It's not something. There is nothing you could have done to stop it. And know that you are not alone. There are so many of us going through this, and you will get through it. And for people who do not have kids on the spectrum, learn to have some awareness and learn to, I don't know if empathy is the right word that I'm looking for, because I don't think sympathy, the word I'm looking for is not sympathy, definitely not it, but
it's more of sensitivity. Like just be sensitive to some things you don't ask to, right?
People.
You don't ask or you
don't say any kind of random nonsense. Don't go passing comments because we are struggling already as is. If my child comes to your house and they are spinning, I have seen them spinning. Don't ask me, is he going to be spinning like this all the time? Don't.
Because if it's going to be a problem for you, that's fine. We're just not bringing you next time.
Yeah.
We're not coming to your house next time.
And be sensitive. And even if I'm not coming to your house, if you meet me on a bus, if you meet me in a churchill, don't say things. You're allowed to think things. Think it and move on. Because I have seen you and I probably think your wig is not nice. I haven't told you that.
I will check.
So you like, I don't know why you don't think.
Hey, relax.
Oh, Lady
Mary, how do you call that?
Don't worry, yours is laid.
I'm just
don't say things and like don't make people feel like they're not raising their kids right.
Yeah, because sometimes even with things around the sensory difficulties, for example, it's like sometimes maybe somebody wants to give your child something and like he won't eat it. It's like I'm gonna imagine a soul now, it's like
Yeah.
you want to give my child something, I say he will eat this one to be fine.
Yeah.
And like then people take jabs as though it's a parenting issue, and it's not. It's not, because when I open autism program, you want my will. But
just don't mock a pain that you have not experienced. Don't do it, because I've seen people on TikTok. I have like a good friend of mine actually said that she was praying for some of these people to have a kid on the spectrum so that they will see. And she was saying it from pain, and I understand her. But on the other hand, I'm like, somebody who is saying things like this about somebody's child on the spectrum, if their child is on the spectrum, they're going to hide their child and treat them. So we don't even pray for that for them, because the child is going to suffer. But do not mock a pain that you do not understand. You cannot understand. Be sensitive to people. And for the parents raising kids on the spectrum, take care of yourselves. And it can only get better from here.
And find yourself, like find the space where you don't have to explain yourself too much. They're out there. There are people out there that you can get to, if the people around you are open, or maybe be now on par, express it to them, and hopefully they can become that circle and support system for you. But if they're not, you find the right people. But yeah.
And if you really need to, I'm not a social media thing, but like Louis is on social media, mainly on TikTok. He's on Facebook too, but he doesn't
Actually,
really
I'm doing it on Facebook. I have an Instagram, and I don't post much, but I do on TikTok.
Oh, I thought you all had like a page that you
It's on TikTok.
It's on TikTok.
And then I go there and do. So I guess what I wanted to add was that if you ever needed to reach out to any of us about questions, please feel free to reach out. It may take us a minute to get to it.
Find me on TikTok.
But we will get to it. And
can you give the social media handle names?
Yeah,
and if you don't get it, if you inbox me too, I can always point you to.
If you search Dr. Louise psychologist, I'll pop up. TikTok is where I spend most of my time, honestly. That's the easiest way to reach me. Instagram, I don't check my DMs on Instagram. So your best one place that you for sure get me is TikTok. And LadyMary, I can send you my business number, and folks can send a voice note to that.
When you send a voice note, though, please go straight to the point. Don't say, "Good morning, please, how are you?" Then you wait for him to come and say, "I'm fine, how are you too?" Then you come and say, "Please, I had a question." Then you wait for him to say whatever you
Thank you.
I'm trying to get the doctor. Is it doctor? Are you spelling out Dr. DOCTOR or just D?
I'm putting in the chat.
Yeah. Okay.
Where's the other sign?
Whilst Dr. Lewis is typing that out, guys, no, I can understand what she's saying. I'm telling you, sometimes Nana, the people that comes on WhatsApp with issues and yeah. But anyways, if you tuned in from wherever, God bless you. Thank you for making time and sticking with us. It's 5:38 p.m. and we are glad that you joined in today. Amazing conversation, lots of information shared. And so I don't know, Nana, we haven't done the flyers for next month, but if we can get them again, if I'm not afraid, I'll probably say maybe somewhere next year or maybe the end of the year. We'll see how that goes. We'll talk to them backstage and see how that goes. But thank you both so much. You share
my social media thing and then the business number on there.
And the private message? Okay.
Yeah, so the business number for a WhatsApp. So if you send me, yes, watch. So let me put the
And go straight to the point as instructed.
please.
Because your question.
The thing is, I go on there maybe like once a week, right? So if I go on there once a week and you said hi, how are you? I will come and reply I'm fine, and I won't respond until another week. Then she said, "Well,
And one thing I wanted to also say that, in going back to just being sensitive, I think, we also need to be appropriate because, why are you just going to just randomly give somebody's child something when the parent is present, or trying to correct a behavior when the parent is present, so it's just about, we can be very inappropriate. And we just need to watch that. But, thank you all so much. I think that it takes a special people to be able to deal, and manage a child with autism. I was telling Auntie Mary that, they are mothers and they are like mothers, because even as parents, think about just your child just having a headache or fever and see how panicky you get, and trying to make sure that your child is well, that you understand what they are saying or what they need every single day. If they are not speaking to you or if they're not able to express themselves, everybody wants the best for their children. And sometimes you just have to figure it out, but having to continuously just figure that out yourself without them being able to express it, or something is bothering them and they can't tell you what is bothering them, So thank you all. And there's a reason why that you all were chosen to take care of those children, because not everybody can do it. And I know that you say, it's difficult, but it seems that you all have your process in place. And thank you for allowing yourself to be here and, make yourself available for questions, just to help the community, because it's needed. Awareness is needed. We've come a long way, but we have a long way to go, so these little conversations here and there, we pray that, it will help somebody that needs it, or even somebody that will be able to transfer it to somebody else, So nothing is done for no reason. Everything is for a reason, and there's a purpose for everything. And we thank you all so very much, for making yourselves available and for being here. And hopefully, we will meet once again and continue the discussion, if not on this topic, on another topic, being that you all are in the mental health field. There's so much to talk about when it comes to mental health.
Yes.
Thank you all so much for being here.
And it was nice meeting you.
You too. And I think Lady went to take care of the kids. So thank you all for joining us. Next month is Women's Health. We're talking about all things regarding women's health. So please join us. We're going to have great and insightful discussions. And thank you all once again. We appreciate you all. Thank you for tuning in.
Yo. Now your matter with it talk. Your life, your wahala, your breakthrough, idea. Welcome to the chat room.
This no be ordinary place. Now a solution they show face. LadyMary they lead the way. With guess where go blow your brain. Talk your matter make we solve them. No judgment, just love and wisdom. We did discuss, we did learn. Every episode you gon' feel the burn. Oh, the chat room. Now here we define the way. Oh, the chat room.
Oh yes.
We go talk out clear, no delay. Oh, it's interactive, educative, informative, and unapologetic. Oh, the chat room. We unstoppable. unstoppable.